Imagine this: you check your blood pressure and it's higher than you expected, your heart is racing, and stress is taking over. But instead of reaching for a pill, you can actually lower it in just a few minutes using nothing but your breath. That is right, your own breathing can be a powerful tool to calm your body, relax your heart, and help bring blood pressure down instantly. Today, I'm going to show you 3 simple breathing tricks that seniors can use anytime, anywhere, to take control of their blood pressure and feel calmer in the moment. One of the most powerful things seniors can remember is that they already carry a built-in tool for calming the body and supporting healthier blood pressure, and it's something they use every minute of every day: their breath. As we get older, the body often becomes more sensitive to stress. Even small frustrations, unexpected news, physical discomfort, or feelings of loneliness can quietly trigger tension inside the body. When that happens, the nervous system shifts into a stress response. The heart beats faster, blood vessels tighten, and blood pressure can rise, sometimes quickly and without much warning. This can feel frightening, especially if you're already monitoring your numbers and trying to keep them in a healthy range. What many people don't realize is that breathing is directly connected to this stress response. The way you breathe can either signal the body to stay on high alert, or tell it that it's safe to relax. Fast, shallow breathing through the chest tends to keep the body in a more anxious, activated state. Slow, controlled breathing, especially when the exhale is longer and gentler, sends a completely different message. It tells the brain and the heart that there is no immediate danger. This activates the parasympathetic nervous system, sometimes called the rest and relax system. When this system turns on, the heart rate can slow, muscles begin to loosen, and blood vessels may open slightly, which can help ease pressure in the circulatory system. For seniors, this is especially important because daily life can include many hidden stressors: medical appointments, medications, changes in mobility, sleep issues, or concern about family members can all create background tension that keeps the body from fully relaxing. Over time, this constant low-grade stress can contribute to higher blood pressure readings. Learning to use the breath on purpose gives seniors a sense of control in moments when things might otherwise feel overwhelming. Instead of feeling helpless when a stressful situation arises, they have a simple action they can take right away to help their body shift gears. Another beautiful part of using the breath this way is that it requires no equipment, no special location, and no cost. It can be done while sitting in a favorite chair, waiting in a doctor's office, riding in the car, or lying in bed at night. That accessibility makes it much more likely to become a regular habit. And while one slow breathing session may only lower blood pressure a small amount in the moment, the real benefit builds over time. Practicing calm breathing regularly can train the nervous system to be less reactive overall, meaning the body may not jump into stress mode as easily as before. This does replace medication or professional care, but it works alongside those treatments as a supportive lifestyle tool. In many ways, learning to breathe with intention is like giving the heart and blood vessels a gentle daily reminder that they don't always have to be in a state of pressure and urgency, and that it's safe, even for a few minutes at a time, to soften, slow down, and let the body settle into a calmer rhythm. The physiological sigh is one of the fastest and simplest ways to help the body calm down when stress levels rise and blood pressure begins to climb. It's called physiological because it's based on a natural breathing pattern your body already uses on its own, especially after moments of tension or emotion. Think about how someone breathes after crying or after a sudden scare has passed. There's often a double inhale followed by a long, relieved sigh out. That pattern isn't random. It's actually one of the body's built-in reset buttons for the nervous system, and seniors can learn to use it intentionally whenever they need support. As we age, the connection between stress and physical symptoms can become stronger. A worrying thought, a tense conversation, or even frustration with daily tasks can quickly show up in the body as a racing heart or rising blood pressure. The physiological sigh works by directly interrupting that stress loop. The first inhale through the nose brings air into the lungs as usual, but the second short inhale helps inflate tiny air sacs in the lungs that may have partially collapsed during shallow breathing. This improves oxygen exchange and helps the lungs function more efficiently. Then comes the most important part, the long, slow exhale through the mouth. That extended sigh out is what really signals the nervous system to relax. Long exhales stimulate the vagus nerve, which plays a key role in slowing the heart rate and encouraging blood vessels to relax. When the vagus nerve becomes more active, the body shifts away from fight or flight and toward a calmer, more balanced state. For seniors who may feel their blood pressure spike during stress, this can be incredibly helpful. It gives them something immediate and physical to focus on, rather than getting caught in a spiral of worry about the numbers. Doing the physiological sigh is simple. Sit comfortably with your shoulders relaxed. Take a slow breath in through your nose, filling your lungs gently. Then, without breathing out, take a second quick sip of air in through your nose to top off the lungs. After that, open your mouth and let the air out in a long, steady sigh, as if you're fogging up a mirror. The exhale should be longer than the inhales, and completely unforced. Even 5 repetitions can create a noticeable sense of relief in the body. Many people report that their chest feels less tight, their thoughts slow down, and their muscles soften after just a minute or two. For seniors, this technique can be especially useful before checking blood pressure, during moments of anxiety, or when trying to wind down at night. It's gentle, requires no breath holding, and can be done almost anywhere without drawing attention. While the drop in blood pressure may be modest, the real power lies in breaking the stress response quickly and safely. Over time, using the physiological sigh regularly can help the body become more resilient, making it easier to return to a calm state instead of staying stuck in tension, giving the heart and blood vessels more frequent breaks from the strain that chronic stress can bring. Slow 4 to 6 breathing is one of the most reliable ways to guide the body into a calmer, more balanced state, and it's especially well suited for seniors because it's gentle, steady, and easy to follow. The basic idea is simple. You breathe in for a count of 4 and breathe out for a count of 6, making the exhale longer than the inhale. That small change in timing has a powerful effect on the nervous system, the heart, and the blood vessels. It helps shift the body away from stress and into a mode where healing and relaxation can happen more easily. When people feel anxious or rushed, their breathing often becomes quick and shallow without them even realizing it. This kind of breathing tells the brain that something is wrong, which keeps the body in a state of alert. Heart rate can increase, muscles tighten, and blood pressure may rise. For seniors who already have concerns about heart health or hypertension, this stress pattern can become a daily strain. Slow, paced breathing works like a gentle signal that tells the brain it's safe to settle down. By deliberately slowing the breath and extending the exhale, you encourage the parasympathetic nervous system, the rest and relax side, to take the lead. The longer exhale is the key. When you breathe out slowly, receptors in the body that are sensitive to pressure and stretch send calming signals through the vagus nerve. This can help slow the heart rate and allow blood vessels to relax slightly, which supports lower blood pressure. It also reduces the production of stress hormones that can keep the body in a tense, elevated state. Over time, practicing this type of breathing can improve heart rate variability, which is a sign that the heart can adapt more easily to changes and is not stuck in a constant stress pattern. For seniors, 4 to 6 breathing can be done almost anywhere and at any time of day. Sitting in a comfortable chair with both feet on the floor works well, but it can also be done lying down. Placing one hand on the belly can help make sure the breath is moving deeper into the body rather than staying high in the chest. As you inhale through the nose for 4 slow counts, the belly should gently rise. As you exhale for 6 counts through the nose or mouth, the belly falls back down. The breath should be smooth and relaxed, never forced. Doing this for just 2 to 5 minutes can make a noticeable difference in how the body feels. Many people experience a sense of warmth, a slower pulse, and a quieter mind. This makes it especially helpful before bedtime, during stressful moments, or even before taking a blood pressure reading. Practiced regularly, it trains the body to return to a calmer baseline more easily, so that everyday stress doesn't push blood pressure up as sharply or as often, giving the heart a more peaceful rhythm to work with throughout the day. The humming breath is a gentle but surprisingly powerful way to calm the body, and it can be especially helpful for seniors looking for natural ways to relax and support healthier blood pressure. At first, it might seem almost too simple to make a difference. After all, it's just breathing out while making a soft humming sound. But that small vibration created in the throat, face, and head has real effects on the nervous system and the circulatory system, helping the body shift away from tension and toward ease. When you hum during the exhale, the vibration stimulates areas connected to the vagus nerve, which plays a major role in calming the heart and relaxing blood vessels. The vagus nerve acts like a communication highway between the brain and many organs, including the heart and lungs. When it's activated in a gentle way, heart rate can slow and the body can move into a more restful state. For seniors who may experience spikes in blood pressure during moments of stress, worry, or overstimulation, this can be a simple way to take the edge off and guide the body back toward balance. Another important benefit of humming is that it increases the production of nitric oxide in the nasal passages. Nitric oxide is a natural compound that helps blood vessels widen, improving blood flow and reducing resistance in the arteries. When blood vessels are more relaxed and open, the heart doesn't have to push as hard to circulate blood, which can help support lower blood pressure. While humming alone is not a medical treatment, it can be a helpful supportive practice that works alongside healthy habits and medical care. The technique itself is easy and accessible. Sitting comfortably, you take a slow breath in through your nose. Then, as you breathe out, you gently close your lips and make a low, steady humming sound, like mm. The exhale should be smooth and unforced, lasting as long as feels comfortable. You may notice a pleasant vibration in your lips, cheeks, and even your sinuses. That vibration is part of what makes the practice so soothing to the nervous system. It gives the mind something simple and rhythmic to focus on, which can reduce racing thoughts and emotional tension. For seniors, this breathing method can be especially helpful during anxious moments before sleep or when feeling overwhelmed. It's quiet enough to do almost anywhere, and even a few minutes can bring a noticeable sense of calm. Some people find that their face and jaw relax, their shoulders drop, and their breathing naturally slows after several humming breaths. Over time, practicing humming breath regularly can help the body become more familiar with this relaxed state, making it easier to return to calm during stressful situations. It is a gentle reminder that the breath and even the softest sound can influence how the heart feels and how the body carries pressure, encouraging a steadier, more peaceful internal rhythm that supports overall well-being. One of the most important things to understand about these breathing techniques is that their real strength comes from consistency and from using them as part of a bigger picture of healthy living. Slow breathing, physiological sighs, and humming breaths are not meant to replace medications or medical guidance, especially for seniors managing high blood pressure. Instead, they work best as supportive tools that fit alongside regular checkups, prescribed treatments, physical activity, balanced meals, and good sleep. When used this way, breathing exercises become a steady daily habit that gently helps the body stay in a calmer, more balanced state. Blood pressure is influenced by many factors, including stress, diet, movement, hydration, and emotional well-being. No single habit controls it completely, but small daily actions can add up in meaningful ways. Breathing practices are powerful because they directly affect the nervous system, which plays a major role in how tight or relaxed blood vessels are throughout the day. When someone practices slow, calming breathing regularly, they are essentially training their body to spend more time in rest and relax mode rather than fight or flight. Over weeks and months, this can help reduce how strongly the body reacts to everyday stress. For seniors, building a routine around these techniques can make them more effective. Doing a few minutes of slow breathing first thing in the morning can set a calmer tone for the day. Using a breathing exercise before bed can improve relaxation and support better sleep, which also plays a role in healthy blood pressure. Even short breathing breaks during the day, especially after stressful events or before checking blood pressure, can help prevent temporary spikes from climbing higher than they need to. Pairing breathing exercises with other healthy habits strengthens their impact. For example, taking a gentle walk and then sitting down for a few minutes of slow breathing combines physical activity with nervous system relaxation. Practicing breathing after light stretching or chair exercises can deepen the sense of calm in the body. Drinking enough water, eating foods rich in potassium and fiber, and limiting excess salt also support the work these breathing techniques are doing behind the scenes. Another key part of this approach is staying connected with healthcare providers. Seniors should continue taking medications as prescribed and share any lifestyle changes, including breathing practices, with their doctor. Tracking blood pressure at home and noticing how relaxation techniques affect readings can be helpful information to bring to appointments. This turns breathing exercises into a partnership with medical care rather than a substitute for it. Over time, these simple breaths can become a familiar signal of safety and calm for the body. Instead of reacting to stress with tightness and pressure, the system learns to soften more quickly. The heart doesn't have to work as hard, blood vessels spend more time relaxed, and the overall rhythm of the body becomes steadier, supporting long-term heart health in a gentle, sustainable way.